Hello everyone, this is Dr. Haque from Center of Integrative Medicine. Today, I'd like to explain why some of our patients and who of our patients need some IV therapies.
I'm feeling awesome. Yes, I'm feeling so good. Now it's gone, completely gone, no more pain.
No, thank God, I'm cancer-free.
I have an amelioblastoma in my jaw. In 4 days,
4 days.
I had no pain.
Ooh,
No
4 days,
pain.
no pain.
That was just one treatment.
Only one treatment, you started feeling like
One.
you're able to sleep, you're able to feel who you are yourself.
I'm happy. I'm not depressed. I'm not sad.
I have completely good in the body.
And my blood pressure is now completely normal.
So I'd like to explain ozone therapy and other nutritional IV therapies, what do you need and when you need. And I like to explain with all scientific evidence so you can study on your own and you can decide what therapy you like to proceed with us. So here I like to share my screen so you can see all the details you can read through and you can see the scientific research, all the medical articles and with references. You can study on your own and you can decide and let us know how can we help you. My dear patients and audiences, very first is the ozone. Ozone is the foundation of all integrative regenerative treatment. What is the ozone? Ozone is a gas. It goes to our body, makes a lot of biochemical reaction to help your body to get rid of disease completely from the root cause. And all other nutritional IV therapies I will explain one by one with a medical research and how it is and why it is so important for you and who do you need that. First of all, if you look at the history, ozone first discovered in 1785 by a Dutch physicist, Martinum Maron. And after that, in Berlin, Germany, they started Institute of Ozone Therapy in 1998. After that, till now, more than 3,000 medical journals, more than 1,700 medical studies, including Harvard, and more than 10 medical books, at least 13 so far I know. And I got opportunity to read a couple of them. It's amazing therapy. There is no other therapy in the history are so much research, so much publication, so many books, and such a long years of history. Initially, it was administered only to detox and inflammation, but as time goes by, it come to mainstream medical treatment, and more than 40,000 physicians has been administering throughout the world. In US, more than 700 medical doctors using in their different clinic this ozone therapy. In US, first 1902, US Congress Surgeon General first stamped and give the approval about this therapy. And 1985, first Chicago Medical and Florida Medical College, first they started the ozone therapy as a therapeutic format. But before that, Dr. Schellenberger in California, he brought that in 1980 and he started researching on it. So far, he wrote a couple of books. He had been administering in different of his medical clinic and promoting throughout the world. And he's very successful. And I learned from his book too. So what is ozone? It is like a 3 atoms in a 1 molecule. Usually oxygen is made of 2 oxygen atoms and 2 oxygen atom makes a 1 molecule. But when oxygen molecule splits into 2 atoms and third atoms comes into 2 oxygen molecule, makes a 3 atoms molecule. So these 3 atoms molecule, third atom is very reactive. And this is called ozone molecule because it is reactive because third atom which kicked in, that is very reactive and powerful. So because of reactivity, it helps to our body in many ways to get rid of pathogenic infections, cellular detox, lowering inflammation, boosting the metabolism, regulating the different important factor in the system, and immune system support as well. So there are many more research is showing that the primary NRF2, which is the body's major software system to function, get activated when ozone goes to our body. And ROS, so especially hydrogen peroxide produces to cleanse the system and lipid get oxidized When lipid get oxidized, ALOP produced is, and very stable, ALOP is a very stable molecule to go throughout the whole body. Whatever it needs, it can heal, it can support whatever it is underworking, and it support the stem cell, bone marrow stem cell to activate, and it helps to boost up the T cell, B cell to boost up the immune system and manage the cytokine release. Not too much, not too control, so that as needed, histamine and cytokine release, so body can regulate their inflammatory processes. Throughout the life, since born to death, we slowly involved with the toxins, indigestion, pathogenic infection, nutrient deficiency, so many medicines and other issues. And we get sick, bodied, undergo age-related disease, cell death, defective cell, wrong protein, lack of protein absorption, inflammation, and oxidative stress. So ozone helps that point to help the body functioning. So what the disease we need a name of, that can be slowly can be healed by ozone support. And suppose whenever cell is underworking, suppose cell membrane, lipid protein get damaged and cytokine imbalance or too much cytokine release, and that accumulation of problem makes a organ dysfunction, and organ dysfunction makes a disease in organ related. As you know that more than 10,000 diseases develop, mostly some organ type, and those organ get dysfunction underworking. People get obese, people get atherosclerosis, people get osteoporosis, or arthritis, tendinitis, all the itis, and then E's, and then cancer and dementia and Alzheimer, and then all kind of autoimmune disease and diabetes and heart-related cardiovascular issues develop. So ozone, what it does, it makes ROS reactive oxygen species. It gets LOP, lipid oxidative product, that helps the body to turn around, start the healing, lowering the oxidation, functioning the organ better, immune system makes the support, immune support, and stem cell goes to the body wherever you're underworking, that heal the organ support, and slowly people can get rid of the health problem. So all organ system, we can say vascular, GI tract, brain, it could be endocrine system, kidney or pancreas, whatever the problem is, ozone can make a way to heal that problem. How? There's two pathway I have here in a two chart. So first chart is, you see, ROS, primarily hydrogen peroxide. It makes the body cell to saturate the oxygen, boost up immune system. And then LOP, also lipid oxidative product, that makes our bone marrow stem cell activation, organ function improvement, and producing nitric oxide. Very powerful, isn't it? It dilates the heart, right? And then it also develop the antioxidant enzymes like a glutathione and other stuff, So these are two pathways. What I just said, this article is a medical article. They clearly showed which pathway it works. You see, when ROS, reactive oxygen species, especially hydrogen peroxide, develop, it helps the oxygen saturation in the body. It makes the platelet grow. It makes hemoglobin, balance and oxygen saturation. And so for our anemic patient who have a platelet low, who have a heart inflamed, who have a blood pressure high, and so many endocrinal diseases, so powerful it works because it lowers the inflammation. ROS get activated, and LOP is amazing. It's long lifespan. It's so that it is stable and it can go see what the body problem is and fix that there. And then there's just my notes. You can take a look. I have with the references. At the end of the article, I have all the references for you to study. You can take a look from there. But at this moment, you can see all the articles in the below the slide. So what kind of drug it is? It's not a drug. It's a pro-drug. Why? Because it comes to the body and support the metabolism, use the lipid to make LOP. It helps our own immune system, all the killer cell. It helps our own stem cell to work better and then healing the system. It's not a drug. It's a pro-drug. Is it toxic? Of course, everything is toxic. If you don't use right format, water is toxic too. If you don't use any even painkiller, if it's too much, is toxic. So everything is toxic depending on how you can use it. That's how make it is useful. So ozone is very useful when you use the right format and the right time and the right process. So that's how it is. And it primarily with 3 different ways it works. Primarily, there are many other ways it works. It helps the bone marrow stem cell. It's antioxidant enzymes like a catalase, superoxide, dismutase, glutathione, peroxidase. These antioxidant enzymes get upregulated. This body becomes so powerfully supported and then cured its own self. Also, ozone support the oxidative stress. As I said earlier, it also gets reacted with a lipid, our lipid, and get LOP. It also makes oxidative shock protein. In acute and serious condition, your protein need to be supported, so get oxidative shock proteins develop. Whenever shock protein doesn't work, all the problem happen. So it gets activated that. As I said earlier, whenever it goes to the body, stem cell to produce its any cell anywhere, any underworking, go and get and do that so that it support the body healing process. And how about the NO and CO? Another 2 important thing. It makes NO, it makes CO. How? It makes NO to dilate the heart. It makes CO. CO is like same important like oxygen for the body system, so that it can absorb, oxygen. It can, get with the oxygen saturated, and it helps the metabolism, cardiovascular system. Also, it helps the growth factor. It's very powerful, and antioxidant enzymes is super important too. It does many more function in the system by production of NO and CO. So there's a few more things you can take a look. But just to save time, I'll let you guys study. Just pause the video and read them, my notes, and share with everyone. So whoever gets that, they can get some knowledge. They can help themselves to get rid of the disease. A lot of people are suffering with so many diseases. They don't know how to get rid of the medicine. They don't know how to get cured. They just keep taking medicine and no hope. Of course, you take medicine. Of course, you're a doctor. But with these regenerative integrative therapies, is powerful. It can calm the root. It can support the root cause of your disease. Ozone helps to get rid of the pathogenic infection. How? It works with a DNA in the genetic level. So gene get activated. It expresses the good gene, suppress the bad gene, and then it can easily kill off all the bacteria and viruses, so that lower the infection in the system. ATP production, everyone need. Every patient who are suffering with a disease, they are struggling with energy. They're deficient of energy. Ozone does that. How? Ozone balance NADH and NAD ratio. So it produces a lot of NAD plus 700 to NADH1. That ratio is important. So ozone helps to produce NADH, as you've seen here. So it helps to NAD plus, so that it can produce ATP easily and then lower the inflammation in the system. There's a more details in here. You can take a look. There is another powerful factor, as I said earlier, nuclear factor, NRF2. Nuclear factor is like a body software. It turns on, body start the healing mode. So ozone does that. And because of that, ozone, when activates NRF2 factor, it helps the gene express. It's lower the inflammation and all the lung disease, autoimmune disease, ischemic disease, gastrointestinal disease, and then age-related issues and cancer, infectious disease, all of them get improved with that. Also, another factor helps to so many other age-related disease and the stress-related disease. It helps to protein absorption, regular cell function, right? It's balance the oxidative stress and free radical in the system. So by activating another factor 2, it also balances the carbon monoxide, nitric acid, and hydrogen peroxide ROS level, so that body can get rid of all the scar tissue, toxins, and then inflammations, and then histamine excessive production, stuff like that. So there is a few more. You can take a look. Another factor has a many things, good things to do in the system, and those are the articles I brought up for you. You can take a look and read my notes. It will be great to be beneficial how it support our immune system, how it's balances cytokine production and oxygen availability and cell functioning. You can take a look. One of the major is the P53 gene. P53 gene is the one helps the apoptosis for the cancerous cell. Usually cancerous cell grow because it's bypass the immune system. But whenever P53 gene gets activated by ozone therapy, what it does, it will help to go apoptosis. So cancerous cell die, it cannot keep grow anymore. So it's a powerful, that this research proven that it helps the P53 genes to activate. And heat shock protein. Without heat shock protein, without a protein support in an acute situation in the body, you get Alzheimer, dementia, you get bacterial infection, you get a lot of metabolic disease, acidosis, and energy deficiency, all the issues, even on a lot of autoimmune disease like ALS and other issue. But ozone can easily help to activate this heat shock protein and then support the cellular function, so body can support the acute condition. As you see in this video, how it activates the protein and help the body whenever needed to produce ATP to support in the heat shock protein situation. So whenever heat shock protein get altered, a lot of problem happen, and ozone can help to regulate in the right condition. Are those all? No. A lot of research coming up. As I said, there is no other therapy in the world or human history that so many medical research published. And it shows that ozone therapy can help these diseases and many more diseases. So it's a very powerful foundation. Is it dangerous? Is it make it damage? No. It breaks anything? No. It makes a tear inside? No, nothing. But it is FDA approved? No, because it's not a drug, it's a pro-drug. It supports the body. And it cannot break or damage or tear anything because we don't administer straight to the body. We take the blood, put into the blood, makes the stable compound so the body can go healing mode with those modified LOP and ROS substances. And it's not going to be approved by FDA because it's not pharmaceutical created. We just make ozone from oxygen in a small machine, right? So it's not a drug, it's a pro-drug, it's no pharmaceutical involved, there's no way of FDA approval. And there is a side effect, yes, could be side effect, but the good thing is we don't just push ozone. We put ozone slowly, small dose, slowly to see how it's going on. And then we can watch, we can monitor, make sure you're hydrated. I've been administering ozone the last 5 years. I never had a single issue. That means it's a safe, with the proper doses, with the proper knowledge, with the expertized medical professional, we are good to go. And we can administer many ways. We can do autoimmunotherapy, sauna, and then topically and bagging, which is a lot of people have a skin issue, which should do the bagging, or psoriasis issue. A lot of people has a infection in the skin. They need that ozone on the outside. Topical oil also helpful, for the vitiligo or psoriasis or dermatitis or skin eczema issues. So there are many ways you administer. We just make the ozone, and autoimmunotherapy is primarily because you can do the lot of 10 pass, up to the 10 pass, even 15 pass people uses. In our center, we use up to 6 pass we use. And then we just take the blood, mix with the ozone, and put it back. Simple, right? And if someone is very sick, doesn't have a vein, we do with a sauna, right? And someone needs insufflation, right? So insufflation helps the body with at least primary basic support we can do, but not a whole lot of changes. So we do with the bagging, we do with the air insufflation, we do with a lot of time we do breathing. Breathing, we don't breathe ozone directly. We make through the olive oil so that it turn into terpene. It's not ozone anymore. So it helps the body with the healing property that converted from ozone through olive oil. So and topically we can use ozone as a ozonated olive oil. I have that in our website, clinic website. We have a couple of olive oil link, couple of this ozone machine. It's a small machine you can use at home to make a ozonated water. You can drink throughout the day. At least you can get some benefit who cannot do ozone therapy, or people who living somewhere that no ozone therapy, established clinic there. So you can buy that machine from Amazon. I have a couple of links, the good companies I mentioned in the clinic website for you. Okay. I also mentioned a few more therapy, which is nutritional IV. Those are FDA approved. And what are these? Vitamin C, we all know that. Vitamin D, we all know that is important for immune support, detox, inflammation, with a healing to the body and energy, production. So NAD plus is extremely important. We talked earlier, liver detox with a lot of minerals and vitamins and major proteins, which is the amino acid basically. So beautification, supporting the gut metabolism. We have a pain support by glutathione. We have a and then few other antioxidant enzyme support. We have a hormone support. We have a weight loss support. A lot of people, especially females, suffering with too much weight and lack of testosterone. Female also suffering testosterone too. New dimension of the disease. And a lot of patients, of course, estrogen dominant is a primary issue. An androgen dominant issue also mostly to the ladies. Some male also suffering that issues. You see the pimples and stuff, and then hair loss and all other sexual dysfunction issues. So we do support all the major diseases with the underlying health issues. With this IV therapy, we can do support inflammation, support the proper functioning of the body. We can help the body with a hormonal imbalance with this IV therapy. We have a licensed medical doctor to use that. Anyway, I like to show a few scientific references. I have a whole lot at the end of the presentation. You can study on your own to learn to be aware of that. So very first is a NAC, N-acetylcysteine. Is a wonderful. There are a lot of research how it is helpful for the rewiring the endothelial cell, lower the inflammation, regrow the organ, and then improve the organ functions. L-carnitine, you all know that. But this alpha-lipoic acid, LSC, and the L-carnitine, these are the pharmaceutical product. It's a natural. It's not a synthetic chemical. So these are the one we administer by our medical doctor. And you can buy L-carnitine from anywhere, but you gotta be careful. This L-carnitine you can find anywhere, even in a smoothie store. I saw they're selling L-carnitine. You gotta be careful. You have to maintain the proper quality and purity when you mix it and then you ingest it or pass to the IV. And alpha-lipoic acid have a very powerful antioxidant. A lot of research coming out. Vitamin D, zinc, colloidal silver, we all know that. And then a lot of research coming out how it's help immune system, and taurine and vitamin B complex and B12, amino acid blends. These are the one we do in different format based on the world research, modulated ratio, and with the proper doses we put as needed, supporting the metabolism, gut lining, detoxing the liver, and then lowering the inflammation, supporting the patient who is struggling with a long-run heart blockage or long-run diabetes and cancer patient, different types of autoimmune disease. You might think, oh, heart blockage, you can do surgery and you're fine, but you're going to be getting blockage again. You need to support the body first. then it will not recur, it will not come back anymore. Anyway, so NAD is so powerful, as I said earlier. It helps that DNA repair, cell signaling, express the good gene, neurological, function. It helps. It balance the histamine and cytokine production. It helps the enzyme activity to metabolize and support the cellular function. So this NAD, is old research, that it is so important for the body, and especially NAD plus has to be 700 to 1 for the NADH. So we put NAD to the IV, so make sure the body have enough right format to prepare the cell regeneration and brain function. It also helps the cardiovascular system, help the liver, heart, lymphatic system, even endocrine system, kidney, pancreas, and then muscle regrow and adipose tissue. It has a lot of function, and throughout our history of our life, we have been we are suffering lack of nutrient, lack of proper lifestyle. We are in a stress, so we are getting deficient of NAD, and this NAD through IV is a powerful support for your body when you are trying to get rid of the disease and trying to heal yourself. Glutathione is a powerful antioxidant enzyme. You can push through IV. You can do shot, either way you like. You have that in our clinic. And immune booster. You can boost up immune system by glutathione, ascorbic acid, zinc, and then all other mixers. And beware the liver. Everyone knows liver function good, you are good, right? You can clean the system. So liver function, we have a lot of mineral blend, vitamin blends, combination of magnesium, zinc, and all other necessary ingredients to support the liver to detox and repair, and all the necessary amino acid that human body need, many essential amino acid to heal the gut system, metabolic system, for the endothelial cell. We have that as a get up and go with a metabolic support, fat burn. We have a different therapy, metabolism therapy, Myers cocktail. This has been using for decades for improving immune systems. Important. NAD have a different format for the brain, for the regeneration, for the cell function in different format we have. We have a brainstorm, we have a hormone support. We have a shot, we have a pill, we have a oil, we have a different format. We have a hormone support. And thank you everyone for watching. And finally, I like to say that extremely important to support your body while you're taking medicine, while you're adjusting your nutrition, and then trying to be healthy, good lifestyle, and supporting your body's supplement. Then by supporting additional support with a IV therapy, ozone and other nutritional therapy, you are going to be rock star. You slowly get rid of all disease, and imagine you have the whole world to enjoy when you can cure yourself. So this regenerative integrative medicine therapy will help your body while you're trying to be healthy, when you're trying to cure your disease, when your medical doctor is giving you a pill to control your disease. These therapies with a right lifestyle, with a proper nutrition, with a supplemental support with this therapy is very powerful. You're going to be getting complete benefit as an integrative medicine approach and regenerating your whole body into the perfect body system. These are the references for you to study. You can study on your own, educate yourself, so you can help yourself and you can help your family. And then you can understand how important these therapies are to get rid of the disease completely. Imagine that we didn't have a disease 100 years ago. Now disease came, disease is growing. Research is coming out that yes, you can get rid of the disease again, go back to healthy life. So this is the references you can read how these therapies can change your body completely other way around. Okay. Thank you everyone for watching again. Bye. Again, if you have any question, please call us or email us. Our email address and phone number, our clinic website and details in the description below. Thank you so much.
I'm feeling awesome. Yes, I'm feeling so good. Now it's gone, completely gone. No more pain. All my body changed. I feel more energy. I sleep and I wake up really active. Before I used to sleep maybe like 10 hours and then I woke up and I was like tired. Then I used to have too much headache all the time. When I had my periods, I used to have pain in my low back. Now it's gone, completely gone, no more pain. What else? I lose some weight too, so that's nice too. Now I'm perfect. 3 months later, I can't believe that. But also, after only just 1 month of being in this change, I was still feeling better. So thank you, doctor. Thank you very much.
I supported her with a proper natural support and IV therapy. Especially we have ozone therapy that's very powerful, and all other therapies that works.
Now, thank God, I'm cancer free. Hi, my name is Rosie Israel. I was diagnosed with stage 4 of non-small cell lung cancer about 2 years ago. A cancer that has only 5% survival. Now, thank God, I'm cancer free. I truly appreciate Dr. Haque that I met over a year ago. I have been consulting with him periodically, and he gave me some really valuable advice on nutrition and lifestyle. Definitely contributed to my being cancer-free to date.
I have an ameloblastoma in my jaw, and I had been experiencing just pain constantly all day, all night, to the point where I literally couldn't sleep at night. In 4 days,
4 days.
I had no pain.
Ooh,
No
4 days,
pain.
no pain.
No pain after going through pain all day, going to work.
No pain,
just
no pain medication.
No pain medication. Nothing.
Wow,
Just
wonderful.
no pain.
Thank you
And
so much
no,
for sharing
thank
that.
you.
Of course, you followed my diet guideline. You took my medicine,
Yes.
and you taking the ozone therapy. So she has been taking ozone therapy, following the supplement guidelines, schedule, and diet modification. So ozone therapy, what does? It goes to the body immune system, and when body makes enough immune cell, it go and kill unwanted things in the body, and the pain comes from lot of inflammation, and ozone therapy can easily lower the inflammation.
That was just one treatment.
Only one treatment, you started feeling like
One pass.
you're able to sleep, you're able to feel who you yourself.
The health issues specifically were GI issues, bloating and discomfort, hiatal hernia. I wasn't sleeping. I was getting up in the middle of the night, restless, urinating a lot. I was depressed. I didn't have any energy. So I had a bunch of issues and some pain, general pain overall.
And how are you feeling right now?
Fabulous. I sleep better. I lost 10 pounds. I don't have any bloating or discomfort. I'm happy. I'm not depressed. I'm not sad.
So taking all the supplements and you're taking our nutritional IV therapies?
And those make a big difference.
Yes, that's
Big difference. I feel my first treatment, I had actually stayed awake the night before from pain that I was having. And that night I didn't have any pain.
Wow.
And I slept. And
Wow.
I felt relaxed, like after a good massage, it's like, I didn't realize how much stress I was holding in my body until I had that first treatment, and then it was like I just gotta, when you take a big deep breath and then you let it out and it just feels so good. That was just one treatment.
Only one treatment, you started feeling like
One pass.
you're able to sleep, you're able to feel who yourself.
And my blood pressure is now completely normal. Well, originally when I first saw you, at a protein spillage amount about 3,800, 3,400. It's extremely high. And the kidney doctor at the time I was seeing, the nephrologist seeing at the time, he had speculated that I might possibly need a transplant within 4 to 5 years. And then of course my blood pressure was extremely high. It's 158/93. It's extremely high. And so of course we saw you and we explained the situation to you, and you told me, don't worry, it's not going to happen. We can fix that. You don't need a transplant. It's going to be fine. So I've been seeing you for about 6 months now, and my blood pressure is now completely normal. So the last two labs we had, my protein spillage in my kidneys is now under 1,000. I think it's 857, I think now.
How was your protein level before?
30, the last lab we did was 3,800, and before that lab, I think the highest I saw was at 2,900.
When you came first time about a month and a half ago, you had a continuous bleeding from the period, and it's never stopping, and you were so concerned about your life, nothing can stop it, and you had other hormone imbalance issues. How are you doing right now?
Well, I'm doing much better now. The bleeding has stopped, and I went back to a regular cycle last week. It began on Monday, ended on Friday, and taking your advice, I feel a bit better. I feel less forgetful. So I incorporated the vegan diet like you recommended. I started eating more tofu, incorporating some greens into my diet as well. I also started taking walks, and I've been taking the supplements. I've been feeling better and going to sleep at a more consistent time.
I have completely good in the body. So I had numerous health issues like blood pressure. I had insomnia, like I couldn't sleep. And I had the pain on the liver side.
Liver side is actually gallbladder pain.
Look, you know that doctor term is the gallbladder, and then constipation. So that's the numerous health issues. I have completely good in the body.
We do like that food supplement. We have nutritional IV therapies. We do ozone therapy, and then we try to help people. And thank you for following that. That's actually your credit. Bye again. Take care, everyone.